Great, here we go. Good morning, good afternoon, good evening to all of you joining us live on the line today. Great to have you with us. For those of you who are new to these events, let me first introduce myself. My name is Anherad Lang. I'm the Executive Director of PHAP, short for the International Association of Professionals in Humanitarian Assistance and Protection, an association of individual practitioners from across the humanitarian sector. This event today is made possible through an initiative of PHAP called the Geneva Humanitarian Connector. This initiative is supported by the Swiss Federal Department of Foreign Affairs with the aim to build stronger connections between Geneva-based actors, other centers of humanitarian thought leadership, and humanitarian field operations, and to promote critical thinking and strategic approaches regarding the trends and challenges faced in humanitarian work. And we're very pleased to be organizing today's Geneva Humanitarian Connector event in partnership with CHS Alliance and with Transparency International. So then, without further ado, we'll get into today's topic. So today's event is going to focus on the key findings from the CREATE report, released earlier this year, which aims to identify the main corruption risks and best practices in the humanitarian sector to promote aid transparency and better accountability. And we have two speakers with us today. We're going to be beginning with Roslyn Answer, a Senior Advisor for the Humanitarian Aid Integrity Program at Transparency International, who's going to start us off with a brief introduction to the issue of corruption in the aid sector, looking at what it is and why it is important to understand. We'll then move to Adele Question, who's a partner of Humanitarian Outcomes and has worked on humanitarian aid policy issues for over 15 years as a researcher and consultant. She's one of the authors, together with François Grunewald, of the CREATE report, and she's going to give us a presentation on the report, looking at the identified main risks to integrity in 4 different specific humanitarian response contexts, and concluding with a series of best practices and recommendations for humanitarian actors to better mitigate corruption risks in their daily work. So then with that, I'm going to turn the floor, the virtual floor, over to our first guest speaker, Roslyn Answer. Over to you.
Hello, just waiting for the slides to come up. Can you hear me?
Loud and clear. Sounds good over here.
I'm just looking to get the slides going. Just to let people know, I'm just going to give you a little bit of background to this CREATE report and explain, as Anurad said, what are some of the big issues in corruption in humanitarian aid. So, you know, what I think the most important thing is what actually constitutes corruption. TI defines corruption as the abuse of entrusted power for private gain. Now, this includes financial corruption, which is probably the types of corruption that you are more familiar with, which would comprise fraud, embezzlement, bribery, contract kickbacks, extortion, facilitation or grease payments for access to beneficiaries, relief goods, or public services. What is not often considered part of corruption, but it is included in Transparency's concept of corruption, is what we call non-financial corruption, which does not reflect itself in the account books. The key features of that would be diversion of resources to benefit non-target groups. For example, goods go to the local authorities rather than to the actual beneficiaries. Nepotism and cronyism, sexual exploitation and abuse, which is a particularly obnoxious form of corruption, or the coercion of staff and beneficiaries to ignore corruption. Now, I also want to clarify that private gain it does not necessarily limited to personal or financial benefits. Private can refer to, as well as individuals, families, communities, ethnic, regional or religious groups, political parties, corporations, and militia. So private is considered in the contrast with public good. Gain can be not only financial gain, but the enhancement of personal or organizational reputation, or for social, economic, or political purposes. Now, one of the things that is always brought up is that corruption does vary. What is considered corruption does vary according to cultural context, and it's very important to take this into account so that we don't have a particularly, shall we say, Western-oriented view of corruption. There is a lot of different ideas around whether nepotism is corruption, whether the exchange of gifts is corruption, whether facilitation payments are part of corruption. And TI tends to say that if there is a malicious intent, an intent to gain from this transaction, then it is considered corruption. But it might be considered simply normal social practices if it is not carried out with malicious intent. Now, how does corruption affect humanitarian aid? Fundamentally, corruption undermines the mission and purpose of humanitarian aid. It distorts decision-making and it increases the cost of goods and services. This can lead to the loss or diversion of life-saving resources from victims. Corruption can damage an aid organization's reputation, and that's particularly important for organizations that depend on private donors and general public donations. It can have a very bad impact on staff morale if corruption is perceived by the staff as existing but going unpunished. Now, unfortunately, we don't have really enough information to give you a reliable answer on exactly how much of corruption, of humanitarian aid is lost to corruption. It's been estimated as high as 30% in the development aid community, but we really just don't have sufficient data to quantify it in the humanitarian aid sector. Now, why is humanitarian aid particularly vulnerable to corruption? Most international humanitarian operations take place in fragile states with weak rule of law and inefficient or dysfunctional public institutions. These countries already have high levels of endemic corruption, and we have a tool called the Corruption Perception Index, and which ranks and scores perceived corruption levels, and most of these countries are ranked very low, and particularly the countries that are covered in the CREATE study, are ranked very low. So the organizations have limited or ability to prepare for or prevent humanitarian crisis or to absorb sudden injections of resources. There's also frequently pressures from donors, from the media, from general public on aid organizations to spend resources quickly, to use them quickly, and this can lead to weak systems and poor oversight. There's been some question about, are we talking about anti-corruption measures here, or are we talking about integrity promotion? And actually, we're talking about both kinds of policies and measures. Anti-corruption, which are measures or policies that are more aimed at deterring corruption, are listed under anti-corruption policies and practices to detect, address, and sanction corrupt behavior. This would include such things as procurement regulations, monitoring and evaluation, audits, human resources recruitment policies, targeting and registration verification, whistleblower mechanisms, and other administrative controls. But there also are a set of policies that TI defines as promoting integrity, and that is behaviors and actions consistent with a set of moral or ethical principles and standards embraced by individuals as well as institutions that create a barrier to corruption. And these could include corruption risk analysis as part of emergency preparedness, management leadership. You may have heard often citing the tone at the top is very important for the implementation of anti-corruption and integrity promotion measures. Codes of conduct, policies on nepotism, transparent access to information, beneficiary accountability, and complaint mechanisms, and improved aid coordination. Now, these practices, as I've said, both types of policies and practices are needed, and they should be complementary. It's just a very brief presentation on what TI has been doing in the humanitarian aid sector in the last 12 years. The first activity was focusing on the publication of a handbook of best practices, good practices, tools for preventing corruption in humanitarian operations. This was published in 2010. It was based on field research done in partnership with 7 international humanitarian NGOs, and it was updated in 2014. There has also been work done specifically in Kenya. There was a food assistance integrity study done in the context of the drought, and it has led to a piloting and testing of an integrated complaints referral mechanism at county level in northern Kenya in the areas that are subject to drought. There is also a online training course on preventing corruption in humanitarian aid in collaboration with the International Federation of the Red Cross. It's an e-learning course, but it's also available as materials for instructor-led training. So this is kind of the background to the CREATE project, and I will hand over to Adele Harmer.
Great. Thank you so much for that. I actually have one follow-up question, if I may, Roslyn. It's a question from Patrick, and maybe a point of clarification, but I think perhaps an important one. So Patrick writes, did I understand it correctly that it should not be considered corruption if it is not with a malicious intent? So he brings an example: if an official wants a bribe, this is clearly corrupt. But should we consider it a corrupt practice of an aid organization who pays the bribe in order to do good, to reach the people that it is trying to reach? What would be your thoughts on this, the point specifically about the malicious intent?
Well, I think that for any corrupt practice to take place, there has to be at least 2 partners in that practice. And sometimes the corruption is initiated by one of the partners, for example, a corrupt contractor, but sometimes it can be initiated even by the staff of a aid organization who is simply taking advantage of their position in the organization to offer favoritism in the contracting. Now, if this corruption is coming from outside the organization, that is the malicious intent. On the other hand, if the organization decides for whatever reason that it's going to, or the staff, that they're going to participate in this corruption, then they have basically endorsed and condoned that malicious intent.
Right, excellent. Thanks so much for that. And just a note before I invite Adele to the virtual floor here, regarding the polls, I saw at least 85% of the participants in the event today have witnessed context of their work in the humanitarian sector, which is quite eye-opening. And then also saw, though it was hard to catch all of the detail in real time, but a lot of thoughts coming through regarding specific reasons why humanitarian aid may be more vulnerable to corruption. So we can perhaps bring a few of those points back into the discussion later. But for now, let's turn over to Adele Harmer. Over to you.
And the study was managed by Transparency International. It was funded by ECHO out of their Enhanced Resource Capacity Facility, and it was undertaken, the research, by Humanitarian Outcomes and Group URD. And in each context, we worked with local partners in the 4 countries that we looked at. So the goal of the research was to produce an evidence base regarding corruption risks and mitigation measures in 4 complex operating environments. We looked at Afghanistan, we looked at the Ebola response in Guinea, we looked at the refugee response in Lebanon, and we looked at the case of southern Somalia. And specifically what we were doing is identifying the risks that organizations face, looking at the mitigation measures they had in place, and then trying to develop some actionable recommendations to address the challenges and to build on good practice. There are individual country reports on TI's website, and also the synthesis report, which encapsulates the findings from across the 4 countries. So just quickly on our methodology, it was qualitative research, and that's something that TI really invests in order to manage the sensitivities of the subject matter that we're looking at. We undertook over 500 interviews with both aid actors, so those representing aid agencies and donors that support them, and we also spent time talking with the local communities in each of the contexts. We did some background research on the wider governance and legislative environment. We were looking at things like, is there anti-corruption legislation in place, and does it cover humanitarian aid? Are there disaster laws and policies in place, and are they clear on the sort of important processes for humanitarian action like taxation and customs and procurement and recruitment? A couple of points on the constraints that we faced. As Roslyn hinted at in her presentation, there are different sort of cultural representations of corruption. There are different senses as to what's tolerable and even acceptable within different societies regards to corruption. Particularly regarding patronage and nepotism, as well as some forms of redistribution of resources. So in each context, we were sort of navigating those different perspectives. Secondly, naturally, there are reputational risks for organizations to talk on these subjects. And in some cases, we faced a simple denial of it being an issue. The vast majority, however, did not take that approach. And then thirdly, we did have some access constraints, particularly in southern Somalia. We had some institutional memory constraints, particularly in the case of Guinea, where some of the relevant international stakeholders had already departed the country at the time of the study. So I'm going to jump right into the findings, and I'm not going to highlight them all. They are in the reports, as I said, but I'm going to focus on a couple that I think will be useful to our dialogue today. So the first is that where you have access constraints, this tends to be a starting point in the program cycle for a long chain of actions in attempts to abuse or manipulate humanitarian assistance, granting concessions of different types, and indeed paying for access was seen as a common risk to organizations and indeed a practice that the organizations needed to take. And this includes some of the sort of obvious things, needing to pay money at checkpoints, paying unofficial taxes or bribes to local authorities, be it state or non-state authorities. And then sometimes more subtle things, like avoiding working in some areas so as not to antagonize a local party to the conflict, or altering the targeting criteria to include or exclude certain groups. And the fact that that happens is not particularly surprising necessarily. What's important, however, is that there's a tendency not to talk about it and a tendency not to document what's happening. Most of the issues are left for local staff and local partners to deal with, and oftentimes organizations maintain a culture of silence, a sort of unofficial don't ask, don't tell policy, either between senior and local staff or between an international organization and their local partner, and including with the donor. And so that brings me to the second point. It therefore matters who and how you work with your partners. And just as a sort of a background point, there's sort of relatively widespread and somewhat unspoken assumption that national organizations are more biased or prone to corruption than international ones. And I want to underscore, we didn't find this. All types of organizations have risks and identified risks with us. And indeed, one finding that we came away with is it sometimes involves collusion between international and national actors. But what we did find is that where partnerships are poorly supported, the risks are heightened, including decisions by local organizations to use program funds to support their own systems because they don't have the funds to sustain their own organizations. And then secondly, risks can be quite high where there are long subcontracting chains between multiple actors, and it has an impact on the quality and the standards of aid programming, and it makes it much harder to monitor. So on to the third area of risk that I wanted to highlight. There's a sort of a tendency to want to ask, does one form of aid, is it more at risk than another? Are certain sectors more at risk than others? We didn't necessarily find that one was more prone. They all had risks, but interestingly, often they were different risks, and so one of our conclusions is that you need different mitigation measures to manage that. For in-kind goods, we look particularly at food, at non-food items and shelter materials, and those risks are high where those need to be transported over long distances in disputed areas, but the goods also need to have a value. So for example, in Guinea, there was the in-kind aid that was being transported didn't necessarily have a value on the market. Then next in service delivery, we looked particularly at health, and especially where there's limited access or there's limited capacity for monitoring. Organizations identified increased requests for payments, increase in costs, sort of inflated medical bills or inflated prescriptions. So there were a range of challenges, but that was particularly where there was limited access to monitor. And then lastly, in terms of delivery modalities, generally cash using electronic transfer modalities, bank and mobile phone, was perceived to be less at risk, and there were sort of lots of examples as to organizations feeling much more confident about that. But equally, the risks remain, particularly at the front end in targeting and then in post-distribution, for example, in taxation of beneficiaries. So then to the fourth area of risk, this is in program support, and there's been proportionally more investment in the tools and procedures for managing corruption in the area of program support. And by that we mean human resources, logistics, transport, and financial management. In our research, we identified an array of risks in the area of human resources, and these are faced at the hiring stages and also at the sort of firing stages, if you will. There are pressures and biases in recruitment, particularly to pressure recruitment of staff from certain communities or groups within society. There are examples of quite serious limitations in reference checks, where sort of the rehiring of individuals goes on even having been identified by the previous organization as having committed a fraud. There are organizations that face with threats and intimidations to terminate contracts. We saw human resources as a particularly challenging area overall to navigate. In the area of logistics and transport in particular, transport costs, particularly in Afghanistan and Somalia, for example, can be quite high, and they can be kept even higher when controlled by just a few who set the prices and conditions. And we found that agencies where they sort of weren't scrutinizing such practices sort of unwillingly or unwittingly enabled corruption. But eating arrangements that are partly based on a sort of conscious decision to transfer risks can also lend itself to that. So costs can therefore be inflated to cover informal taxes and other fees imposed by militant groups or by local authorities. in order to move goods through to final delivery points. In the area of procurement, another area of quite a significant amount of focus over the last decade to try and ensure systems are in place. We still identified quite significant risks, particularly Somalia and Afghanistan. There were examples of organizations facing challenges and sort of kickbacks for securing contracts in collusion to inflate contract values. It wasn't an issue in all contexts, however. In Guinea, example, partly because I mentioned the sort of quite specialized goods and primarily international procurement meant it didn't face so many challenges there. And then there's the last point on financial management and controls. High reputational risk organizations see in managing their finances and managing them well. So it is highly controlled, but challenges remain. And one of the areas that we identified was in sort of partnerships or financial transfers to public institutions that didn't have strong financial management capacity. Now I'm going to move on to the mitigation measures and just sort of quickly go through these with you and then open it up to the recommendations and then to your comments. So many good practice examples exist, but much of the investment in good practice has been made at the individual agency level. And just to give you some examples here, most organizations, most international organizations, have anti-corruption policies in place. They're well established now, but the knowledge of those, particularly at the field level and beyond capitals, the training and the contextualization is variable. It is sort of insufficient to have a policy at headquarters, but to not have that sort of more contextualized and rolled out on an ongoing basis at the country level. What we did find is where organizations have supportive leadership that encourages a dialogue on corruption experience and risk, there was a much greater sense of confidence of staff and of partners to work with those organizations and to manage the many risks that are faced on a regular basis in working in these countries. Those organizations also that took in-depth sort of socio-political or political economy analysis and risk analysis of their operating context. Knowing all the ways, for example, that one could be extorted allows you to establish ways to manage those risks and to set red lines. And we saw organizations investing in that much more. And it's not the day-to-day of their programming requirements that, that one would necessarily make those investments. But they realized in those contexts that it was absolutely necessary to being able to sustain their efforts there. Employing staff with diverse profiles, rotating staff where security conditions allowed was also seen to be another way of managing the particular potential biases or other collusion that goes on internally in organizations. Significant investments in partnerships, both organizational capacity support and operational capacity support was seen as a significant and useful mitigation measure. In the wider area of program support, there are lots of good practices, as I mentioned. There's been investment over the last decade, I would say, in a whole range of ways to strengthen organizations. Lots of good practices in HR we documented, but in addition, we still saw challenges, particularly in independent recruitment, particularly being able to conduct thorough and verified reference checks. And then lastly, a point is that we found is where organizations have evidence that they are particularly exposed or particularly at risk, some have conducted wider organizational change processes, which are sort of multi-year. They can take many years and sort of many facets of the organization are involved. And it can include pausing or withdrawing altogether from a context for a period until such time as that organization better understands the sort of internal and external pressures that it's facing. Now, just a couple of points at the sort of the interagency level and the role of donors. So We were struck by how limited the interagency dialogue is on the topic of corruption, and hence it's really a recommendation, not that we'd say it's sort of being well practiced as a mitigation measure at this stage. Different contexts may have suggested differently, but in the context we looked at, we didn't see that interagency dialogue as particularly robust. But that said, there are some really promising mechanisms for assessing collective risk, or sort of assessing this collectively. And in two of the contexts, we saw the establishment of risk management units. I understand it's also on the agenda for a third of the third context that we were looking at, and that's in Lebanon. Now, these units have had teething problems, but from what we understood and we found in our research, they play an important analytic and potential capacity building role, but including for local organizations. So we found that to be a useful mechanism to bring organizations together to discuss the risks that they face. And then secondly, the advent of access task force and working groups. They're sort of burgeoning in the countries that we looked at, and therefore the roles are still to be shaped, but we did see that they could be important mechanisms, particularly for that reporting of different sorts of constraints that organizations are facing in the field, and the means by which you can establish collective ground rules and red lines in relation to unacceptable practices. And then lastly, in mitigation measures on the role of donors, donors play what we felt was a sort of a complex role. They've certainly provided support to agencies in terms of policy and training, but the policies themselves are not, their own policies are not necessarily well understood or necessarily having the effect that's intended. Zero tolerance policies, which don't mean that corruption can't happen, but just that it needs to be comprehensively addressed when it does, isn't particularly well understood. And it has the effect, from what we can see and from the organizations that we spoke to, of actually inhibiting discussions of actual corruption, including diversion, and the potential compromises that organizations have to make. And then secondly, what we found is that current reporting to donors isn't necessarily bringing to light corruption experience. It's actually incredibly low when you look at reported figures. And equally, on the flip side, donors themselves don't tend to share experience with their partners. Just a couple of points on accountability measures. There has been, and this won't be surprising, an emphasis on upward accountability. And we found that there's a critical need to invest more in participatory programs in accountability to affected populations. M&E mechanisms generally tend to have sort of pressures to show positive results. Agencies aren't rewarded ever for bringing negative or difficult results, which therefore is challenging in increasing the dialogue on corruption. There has been a use of third-party monitors to sort of increase monitoring capacity, particularly where access constraints prevail. They can be really good tools for verification, but we also notice that it can crowd out the expertise of organizations to do their own monitoring, and also weakens links to communities. So generally we'd say there's significant room for improving accountability to affected populations, and more coordinated efforts on that front would also be very welcome, particularly from the affected populations perspective. And then lastly, to the recommendations, we have a really wide range, and they're quite targeted in the report, so I'd encourage you to look at them. Just to say, we couldn't stress over and over again the need that we saw to increase the dialogue at an inter-donor level, at an interagency level, and of course within organizations. We also felt that this sort of tone at the top, the sort of idea of having open and principled leadership, and that comes from the top of the humanitarian leadership sort of the sector as much as within organizations, is going to be critical. Secondly, let's find some ways to sort of increase positive incentives for reporting of risks and of actual experience. And then, as I mentioned before, investments in partnerships and in more inclusive and participatory programming is key to managing risks across the board, particularly in remote management contexts where organizations face access constraints. And then these last 2 points are related. One is that we saw some, but it's very burgeoning, good practice in assessing risks of corruption, but doing that in a very structured way, and then comparing that to the scale and the urgency and criticality of needs. And organizations, therefore, can look at all of the mitigation measures they can put in place once those risks are understood and as compared to the criticality that they have identified in terms of their need for the intervention. But what we do need to recognize as well is that most likely you cannot mitigate everything and residual risks are likely to remain. And so what we're recommending is that we need to sort of forge a more common approach to jointly owning that risk between donors and agencies so that we do make sure that we're able to provide life-saving assistance as and where it's needed at points that are incredibly critical to vulnerable populations, and that organizations don't have to second guess the sort of complications that may come if they do face some of these challenges, that those conversations have happened with donors in advance and not after the fact. I'll finish there, and apologies again for the audio. I hope that's been clear for you, and I'll now hand back to our host and welcome your questions and comments.
Excellent. Thank you so much. Very interesting presentation overview of the findings there, and I'm sure that everyone will be eager to dig even deeper then into the results of this really interesting research. We have a lot of questions that have come in, and I can see already we're not going to have time to address them all, but we will certainly do our best to get in as many as we can. First, Adele, a follow-up question that came in from Pamela in Lebanon. She's wondering, could you please elaborate a bit more on how you see investment in partnerships can reduce corruption?
Yes, so increasingly, firstly just to say increasingly we see, and particularly in areas where access are constrained, an increased reliance on working with partners. Now, often where access is constrained are in and of themselves sort of resource-poor areas, where if an organization, your partner organization, is working, they don't have access, particularly to the sort of organizational funds that strengthen their organization and allow them to work throughout a disaster. And they don't have access to core funding. And so what we found is that organizations, local organizations, will make decisions either of their own personal salaries. They'll use their salaries to pay money at checkpoints, or they'll use the operational funds to manage things for their organization that otherwise should be intended for an operational response. In order to mitigate that, we see a need both for donors to potentially directly support and for international organizations to really increase the support that they give to those organizations that they are highly dependent on in order to ensure access to the populations that they are there to serve. And that can come in the form of, it should be done based on a risk assessment. What are the sorts of things that this organization could potentially need to do in order to manage its program? It might be security related, it might be financial management related, it might be other organizational support that involves doing their own risk analysis. But those sorts of things seem to be constantly raised with us by local partners themselves and with internationals, realizing that they were working with partners that were probably not as equipped as they were to manage those contexts, other than the fact that they were local to it and therefore potentially more acceptable and able to manage the security risks. Thank you.
All right, excellent. Thank you. Now we have a question coming in from Yusuf in Turkey. Maybe a bit of a tricky one, but we see it echoed actually in a number of questions that are coming in. Yusuf writes, did you find any good experiences from NGOs in cases where they actually did agree not to pay armed groups or transfer additional funds to certain entities and communities in exchange for better access? Relates a little bit to some of your other research as well, Adele, I think. What are your thoughts?
So, I guess the point is we absolutely saw organizations who resisted making payments to local authorities and to non-state armed actors. And interestingly, when we were given those examples, they themselves said they were surprised sometimes when they weren't additionally pressured, which made them think that other organizations working in those areas were probably quick to make those payments. What it spoke to for us is the fact that there are organizations refusing, and that didn't necessarily limit their access. But what the challenge is that information is not being shared, even at that localized level between organizations as to the different practices that organizations take. And then secondly, I guess just to say, there did seem to be this sort of strong understanding of, who pays and who doesn't, or this sense in which, we know that organization is a highly principled one, and we know it won't pay, for example. So there's sort of some generalized common knowledge, but there isn't formal conversations or a means by which that information is shared between organizations in order to give them confidence, another organization confidence, for example, that it may be able to resist those claims on their resources. Over.
Okay, great. Thank you for that. We now have an anonymous question submitted for Roslyn. So if I could turn to you next. Anonymous writes, despite having trainings and robust policies, we still in our organization have many cases of fraud. So how can one effectively have behavior change among staff? Any insights?
Okay. Basically, it's a question of the incentives that are presented to organizations and to staff or local partners. And this relates again to what Adele mentioned, the tone at the top, the supportive approach to management, to being more open and discussing more in-depth corruption risks and what can be done about them. If it is perceived by staff or by a partner organization or a local organization that they will be, if they report corruption, they will be in effect punished. And that can go anywhere from losing contracts to being ostracized in your working group to actual death threats. If those negative incentives for reporting are not counterbalanced by positive incentives which reward staff and partner organizations for actually reporting behavior, I think things will not change.
Thank you for that. And actually a perfect link into my next question that I was going to address to Adele. So Adele, let me turn to you again. This is a question from Anika, working in Mauritania, who writes, how do you handle security risks related to exposing or mitigating corruption, especially internally? So risk of retaliation, notably in context with high levels of violence already present. Any thoughts on that? Over to you, Adele.
Yeah, thank you. It is an excellent question. It came up often in our research. I guess to our colleague in Mauritania, I'd say the first thing is the important one is that you've identified that it's a security risk. Often organizations reported not realizing that that's where it would eventuate, that the sort of threats to staff, to the organization wasn't something that they anticipated. So first and foremost, it's doing that risk analysis to understand that making some of those decisions may well increase the organization's security risk profile. And then secondly, these aren't necessarily all good practices, or they at least have ramifications. And I think it's just incredibly important for organizations to sort of be conscious and to think forward as to what the possible implications will be for different decisions. But we often saw staff let go without necessarily, we were told of situations where staff were let go from organizations without identifying why. In other words, the reason for potentially fraud or something wasn't mentioned. It was just that the role had to close. Sometimes, so in other words, the information isn't necessarily sort of upfront and put forward, but it is done therefore to limit the possible retribution that might come. But equally, we saw situations where decisions were made to keep staff on in order to manage that security risk. In other words, they add on to the organization. Whether that's good practice or not, I'm really hesitant to say, but what I think is good practice is consciously making those decisions at an organizational level, ensuring that senior management own those decisions, and making sure that the implications forward have been well thought through.
Terrific. Thank you for that. So I'm going to try to squeeze in one more question to Roslyn, one more to Adele, and then I'll go back to both of you at the very end for some brief closing remarks. So question to Roslyn. This is from Raylene, connecting from Australia, wondering, do existing whistleblowing laws effectively protect those reporting on corruption in the aid sector?
I would like to distinguish between whistleblowing practice within an organization and whistleblowing laws in the country of operation. I believe that the whistleblowing practices in organizations that have introduced that have been reasonably effective in protecting staff confidentiality and trying to protect staff from retaliation. Not perfect, but I think they're well implemented. However, in the countries where the humanitarian aid takes place, there may be laws on whistleblowing but that are not implemented. There may be no law, and there are many countries where there is no legislation on whistleblowing. There is no national protection scheme for whistleblowers. So it is an important question, but I think it's likely to be more quickly handled within an aid organization than trying to get the country to implement comprehensive whistleblower legislation.
Thank you. And then a last question to Adele. This is from Eva from Finland. So in the context of cash transfer programming, it's a known problem that we're transferring the risk of purchasing substandard items from the organization to the population of concern. Is it also a risk that we're transferring corruption risk to the population of concern unknowingly? Over to you, Adele.
Thanks for the question. I think the answer is yes. It is a potential risk. So risk transfer generally is something we identified, whether it be sort of transferring risk to trucking companies, to transport goods, or using cash modalities and leaving to sort of the market to determine the quality of goods and the price point. I know that in the field of cash there is enormous amounts of monitoring that does go on at the market level, and there are good practices, and certainly there are decision points that organizations need to make as to what's acceptable and what's not. That becomes a sort of a relationship between the private sphere and the public sphere, I guess, and it is something that's important for organizations to be acutely aware of. But I do think that our cash colleagues would have good practice and would encourage sort of further thinking around that in relation to corruption exposure. Back to you.
Okay, great. Thank you. So let me see if we still have Roslyn on the line. We've had a few little challenges here. If we do, Roslyn, as we've come to the end of the hour, I would like to turn to you now for any closing thoughts you would like to leave us with today on this subject. Roslyn, do we still have you?
The main point I would like to make is that many of these corruption issues in a particular humanitarian context would best be addressed by collective action among the aid organizations. If you are having resistance or problems with any government regulations, or you need extra security protection, I think it's much more powerful if the aid organizations can have a joint position and therefore a joint approach to resolving these collective issues. Now, in order to achieve that, there has to be a lot more dialogue on corruption issues among aid organizations, much more than exists right now, as Adele has said. And without this kind of dialogue, you won't be able to have effective joint action.
Okay, great. Thank you. And thanks so much for being with us, Roslyn. It's really been a pleasure to have you in the event. And now, Adele, if you have any closing remarks you'd like to share with us, please do. Over to you.
Thank you, and thanks to everyone for joining today. I do see as sort of as a means by which we can measure research uptake. It's incredibly important that PHAP and CHS Alliance have hosted this forum, and that we've gathered, a really interesting array of practitioners from all around the world to come and think about these issues. That's a huge first step in increasing the dialogue, as Roslyn refers. And just to underscore and to, sort of leave us, I guess, with this issue, is that there is a real tension between highlighting corruption risks while at the same time ensuring that there remains a real commitment to prioritize aid to highly vulnerable populations in these very complex operational settings. And this research and these conversations are sort of not done with a view to jeopardize that funding, but rather to sort of identify what the critical issues are and to stimulate improvements in order that the scarce resources that we have in the humanitarian community are used for these incredibly important unintended purposes. And so whatever we can do to continue to sort of emphasize that message, that we want to have conversations on corruption, we want to understand the risks that we face, and we actually really do want to understand and learn from real practice. But equally, that shouldn't jeopardize our ability to continue to work in these environments and to do the work that humanitarians are intended for in these vulnerable places. Thank you.
And thank you so much, Adele. Thank you for your work in this area and for leading us through this really, really useful conversation about some of the key points. Again, great to have you both with us. I'm happy to tell everyone, although we were not able to get to all of the great questions that came in today, both of our speakers have graciously agreed to help us with the follow-up on those after the fact. So together with the audio recordings and video recordings of the event, we look forward to being able to follow up as well in writing on a number of the other questions that came through. So thanks to all of our participants for great inputs throughout the discussion. Thanks again to our guests, Roslyn and Adele, for their remarks. Just to mention the yes, the the resources are going to be available at the link you just had in front of you that will also be emailed out after the event. And I do hope that many of you will consider joining us. We're going to be as PHAP at ADEX 2017. This year's topic at ADEX is Results Through Transparency and Accountability. So a great opportunity to continue many of these discussions that will be taking place in Brussels on the 15th and 16th of November, and participation is free. You can click there right now to register, and hopefully we will see some of you there to continue the conversation. Otherwise, in the online sphere, we have a couple of upcoming events I'd like to highlight. On the 7th of November, as part of the Humanitarian Evidence Week, PHAP will be hosting an online discussion focusing on the concept of evidence and how it has been used in the humanitarian sector. We'll have an introduction by Paul Knox-Clark from ALNAP, which will be followed by a moderated discussion on the dilemmas of evidence with a panel of experts with Nancy Cartwright, a professor of philosophy at University of Durham, Lars Peter Nissen, director of ACAPS, and Mamadou Touré, development advisor based in West Africa. Then 2 days later, on the 9th of November, PHAP and ICVA will organize the last session of the ongoing learning stream on humanitarian coordination. This one will focus on how NGOs can better engage and interact with government-led coordination structures and on NGOs' role in the refugee coordination model. The event will feature presentations from Humanitarian Outcomes with Paul Harvey this time, also with Vikrant Mahajan from Sphere India and Arafat Jamal from UNHCR. You can read more about this upcoming session and register now by clicking on the banner. So with that, this is the team from PHAP and Herod, Marcus, and Liz signing off from Geneva and looking forward to seeing you all next time. Over and out.